Before auscultating the posterior thorax, let's review normal and adventitious breath sounds. Normal breath sounds are classified by their intensity, pitch, and duration during inspiration and expiration. Vesicular breath sounds are soft and low-pitched. They're normally heard during inspiration and the first third of expiration, and can be heard throughout most of the lung fields. Bronchial breath sounds are louder and higher in pitch than vesicular sounds. The expiratory sound lasts longer than the inspiratory sound, and a silent gap separates these two sounds. Normally, bronchial breath sounds are sometimes heard over the manubrium. Bronchovesicular sounds have an intermediate pitch and intensity. Inspiratory and expiratory sounds are about equal in duration, and a silent gap may or may not separate them. These sounds may be heard in the first and second interspaces anteriorly and between the scapulae posteriorly. Let's listen to these sounds again to compare them: bronchial, bronchovesicular, and vesicular sounds, in that order.